Hello, this presentation is on statistical significance versus clinical significance, prepared by Nkechi and Wumi. The main article used in this presentation is an overview of statistical and clinical significance in nursing research by Bayer and Nicole, 1997. The topics for discussion in the presentation are the definition of statistical and clinical significance, the importance of these two concepts in nursing research, example, and that's application of both concepts in a research study, and utilization, that is how a practitioner will utilize this difference in a literature review. Statistical significance. It is important to know that both statistical and clinical significance play a unique role in nursing research, and these two concepts cannot be interchanged. According to Melling, Final Overhaul, statistical significance is used to determine whether an effect happened by chance or even from the study intervention. This describes how reliable the result of a study is on patient outcome. Hypothesis testing and null hypotheses are created. These are created mainly at the beginning of a research. The hypothesis refers to what we think or expect to happen based on the research conducted, while the null hypothesis basically proves that whatever intervention suggested in the hypothesis testing did not work. In other words, there is no relationship between or among study variables. A p-value, which is the probability that a null hypothesis is true, is calculated when statistical analysis is performed in the study data. The smaller the p-value, the likelihood that the findings occurred by chance is reduced. A p-value of 0.05 or less is considered a statistically significant result in many healthcare research. If the null hypothesis is true, it means the likelihood that the study finding occurred by chance is minimal. Clinical significance. Clinical significance basically helps show the relevance of statistical results on a study on patient outcome. In other words, how beneficial is the result of the study in relation to improvement of patient in a clinical setting when applied. Findings can be clinically significant by directly influencing clinical practice, irrespective of the study being statistically significant or not. It also helps show the relevance of statistical results of a study on patient outcome. Importance. While researchers can use statistical significance to accept or reject a null hypothesis, the same is not for clinical significance in research. In order to know the relevance of the statistical results in a clinical setting, researchers use both clinical knowledge and critical thinking skill to interpret these results. The ability to understand and interpret a research study helps with the implementation of evidence-based practices in nursing. The clinical significance of any research comes down to how beneficial the statistically significant of research is to cause a positive change in the overall patient outcome. Statistical significance gives researchers the confidence that the results are real and consistent over time. More so, during the planning phase of a study, the researcher must do two important things: form the null hypothesis and establish statistical significance, which is known as the alpha level. Example. The example that was used in this presentation is on a cohort study that investigated the efficacy and safety of performing primary unilateral total knee arthroplasty the TKA, in the C-hour period. That's between 9 a.m. and 11 a.m. Compared with the wee-hour period, and that's between 1 and 3 p.m. Statistical importance, significance of this study concludes that there is a greater benefit to patient outcome for TKA when the surgery is done in the C-hour period. Probability value, the p-value, was 0.011. The significant level, which represents the alpha, was greater than 0.05, and p-value was less than alpha on conclusion. Statistical significance cannot be the sole maker for whether or not a study finding is valuable to practice. We also need to consider the clinical significance. And this study shows that blood loss can be reduced when TKA is performed in the C-hour period, which may be due to the increasing platelet count, and postoperative complications did not increase compared with the wee-hour period. Considering the benefit of this outcome on patients, it was recommended that the selective operation, such as TKA, should be performed in the C-hour period in clinical practice between the 2-hour period. Utilization. Change in treatment plan should not be based on statistical significance alone. Both clinical and statistical significance should be weighed in determining the effectiveness of treatment. In order to get the best patient outcome, the use of evidence-based practices is essential. While reviewing the literature, a practitioner should apply the knowledge and acquired skills to interpret if the statistical significance of a research study is enough to be interpreted in such a way that will cause a positive change in the health status of a person or group in a clinical setup. Also, we have to know, or the practitioner needs to know, that when considering a research, the size of a sample group could sway the results of the study. A small difference between large groups may be statistically significant, where only few people will benefit from it, while an intervention might be statistically significant in a study with a large sample, but it will not be clinically meaningful. On the other hand, a large difference between small groups may not be statistically significant, but may make an important clinical difference. This is where the practitioner comes in to make a clinical judgment on what to accept. However, it should, however, be noted that not all statistically significant results are clinically significant. Hence, they cannot guide clinical practice. Thank you. And this brings us to the conclusion of the presentation. You have all the references noted in the presentation. Thank you.